The phrase combative patient, quite possibly more dangerous than the actual person that you're dealing with. I'll explain in this episode of Chronicles of a Culture Changer. Hello and welcome. I'm Teitsort, founder of DT4EMS, where we're all about saving yours while you save others. In this episode of Chronicles of a Culture Changer, we're going to show you that the words combative patient should never be spoken in medicine and are quite possibly more dangerous than the actual person that you're dealing with at the time. Combative patients. In Eve, we believe they don't exist. And I know what you're thinking. Man, I deal with them all the time. I get that. But what we're going to do today is show you that really they don't exist. Purely by definition, combative or combat, that requires willing combatants, meaning people that want to engage in some form of battle. If fight requires two willing combatants, should we ever be in a fight on the job in medicine? The answer is obviously no. We might use force in legal patient restraint, or we may use force to defend ourselves, but we should never be willing combatants in a fight. Consider then the word patient. For us to have that relationship, for a provider-patient relationship, we had to have some form of consent. So if there is a person that is wanting our help via consent, how does the phrase combative patient go together? So a person says, let's fight, but please help me. No, let's fight, but please help me. So the phrase itself there, just in definition, lends to providers being confused. Providers, whatever the level, were drawn to medicine for some reason. This compulsion, this wanting to help, is what drives us. So when we think of a patient, because that's what we want to do is help patients, those people in need, when you put the word combat in front of it, so you have combative patient, what happens to us as providers is we want to enter in, touch people, or remain connected with people that at a moment in time may not actually be a patient. So we wrestle with this combat. Oh, I gotta touch you, combat it, but they're my patient, but they're wanting to fight, but they're my patient. And so you're willing to place yourself into a more dangerous situation because of this compelled feeling to help others. Again, noble, but dangerous. So if we keep calling this person a combative patient, the only thing a person reading our documentation or hearing our story can relate it to is what they believe a patient is or is not. Say for instance, you write this report up that you had a combative patient and they choked you or they punched you, and again, these things happen all the time. If you press charges, first of all, the police officer keeps hearing the word patient. Someone who needs our care, someone who wants our care. The next piece would be, from the police officer doing the report, would be the prosecutor, the judge, and the jury. They too themselves hear patient, patient, patient. So if the judge is looking at the report or the prosecutor is looking at the report, and the only thing they can relate a patient to is say, well, man, when my mom had that stroke, she didn't know what she was doing. She was kind of out of it. And when that nurse was trying to start the IV, she scratched her and drew blood, but my mom didn't mean to do that. So people have a hard time when you say the words combative patient because they can only relate it to what they believe. We believe in our EVE program, our Escaping Violent Encounters, that we teach across the country for either pre-hospital or in-hospital, two different versions. So you have cooperative, you have uncooperative, and then you have the criminal aggressor / attacker. A cooperative patient, that is a person who wants to be there, who has given you consent, who wants your treatment. You can have an uncooperative patient, is not cooperating with your treatment. This person could be hypoxic, hypovolemic, diabetic, septic, traumatic brain injury, whatever it is you believe in your mind needs your help, would want your help at any other time. The criminal aggressor or attacker who tells you they're going to hurt you and then tries some way to hurt you. Intoxication does not negate this person's criminal activity in most places. Meaning if a person was drunk driving and they ran over your child, the police show up and go, well, shucks, he didn't mean it, he was drunk. No. The moment you take and remove the phrase combative patient from your vocabulary, you and your peers will be instantly safer. It's a promise. We've seen it all over the country. So if you believe in our message and understand what we're trying to do, which is saving yours while you save others, please subscribe. Share this video with some of your peers in medicine. Let others know we exist. We're here for you because it is the dirty little secret in medicine that no one wants to talk about, but yet it's the leading cause of injury in healthcare, and that's violence. I'm Teitsort. Thanks so much for watching. Don't forget to subscribe. We'll see you soon.